You have seen at least 3 different doctors in the last 2 years. One for your joints, the stiffness in the mornings, the ache in the knees or hips that was not there 5 years ago. One for the fatigue, the kind that sleep does not fix, that sits behind your eyes and in your legs no matter how early you went to bed. And perhaps one, visited more reluctantly, for the fog, the thinking that used to be quicker, the word that takes a moment too long to arrive, the sense that your mind is working through something it didn't used to have to work through. 3 appointments. 3 conversations that largely did not reference each other. 3 sets of advice, possibly 3 separate prescriptions. And somewhere underneath all of it, a quiet, persistent feeling that no one has quite found the thing they are actually looking for. What if there is a thing? What if your joint pain, your brain fog, and your fatigue are not 3 separate problems your body has developed independently? What if they are 3 expressions of the same underlying process, and no one has connected them because each specialist was only looking at one room while the same fire burned in all 3? That question is what this video is about. And the answer, according to a substantial and growing body of research, is yes. Stay with me. Because in the next few minutes, I'm going to show you the single biological mechanism that links all 3 of those symptoms, not theoretically, but through a pathway that researchers can now trace from your gut to your joints, your brain, and your cell's ability to produce energy. And once you understand that pathway, the fragmented care you've been receiving will look very different to you. At around the 8-minute mark, I need to tell you something about the medication that millions of people take specifically for joint pain: ibuprofen, naproxen, the over-the-counter anti-inflammatories that have probably been part of your routine for years. What that medication does to the part of your body driving the brain fog and the fatigue is something almost no one prescribing it has discussed with you. I'll give you the specifics and the alternative conversation to have instead. I have spent more than 3 decades in geriatric medicine, and the pattern I'm describing, joint pain, cognitive change, and unexplained fatigue arriving together in the same person at the same stage of life, is one of the most consistent patterns I have seen. For most of that time, medicine treated each symptom separately, because that is how medicine is organized. The research now offers a different organizing principle, and I believe it is going to change how you think about what you've been experiencing. Let me give you the mechanism. And let me start with a word you may have seen before but may not have fully heard explained. The word is inflammaging. It describes something specific: a state of chronic, low-grade systemic inflammation that is not the inflammation you feel in an acutely swollen joint or a fever. That kind is acute, visible, purposeful. Inflammaging is different. It is the immune system stuck at a permanently slightly elevated setting, not responding to a specific threat, just running, quietly, continuously, producing inflammatory molecules, particularly a group called cytokines, including IL-6, IL-1 beta, and TNF-alpha, at levels that are too low to trigger obvious symptoms of illness, but too high for your tissues to function without consequence over months and years. Think of it as a fire that has been burning in the basement of the building for so long that everyone on the upper floors has started to accept the faint smell of smoke as normal. Now here is what those cytokines do when they are continuously present at low levels. In your joints, IL-6 and TNF-alpha directly stimulate the cells that break down cartilage and inflame the synovial membrane, the lining of the joint capsule. The result looks like arthritis. It responds somewhat to anti-inflammatory medication. But if the cytokines producing it are not coming from the joint itself, but from a systemic source, treating the joint locally is addressing the smoke in one room while the fire burns on. In your brain, those same cytokines cross the blood-brain barrier and activate the brain's resident immune cells, the microglia. Activated microglia release their own inflammatory compounds, disrupt the synaptic connections responsible for memory and processing speed, and impair the production of the neurotransmitters that govern focus, mood, and mental clarity. The result looks like early cognitive decline or depression. It gets investigated by neurologists with memory tests and by psychiatrists with medication trials. But if the source is systemic cytokine exposure originating outside the brain, no amount of cognitive intervention reaches it. And in your cells, and this is the part of this picture that most people have never heard, because it is relatively new research, IL-1 beta specifically impairs the function of the mitochondria. Your mitochondria are the energy-producing structures inside every cell in your body. They generate the molecule, ATP, that powers every biological process you have, from muscle contraction to nerve firing to organ function. IL-1 beta interferes with a specific component of the mitochondrial energy chain, what researchers call complex 1, and the result is a measurable reduction in the amount of ATP your cells can produce. This is why inflammatory fatigue is not the same as being tired. You cannot sleep it off, because sleep does not repair mitochondrial complex 1 inhibition. You cannot push through it because the problem is not motivation or fitness. It is your cells generating less energy than they are designed to, and it is not in your head. It is in your biochemistry, driven by the same cytokines causing your joint inflammation and your brain fog. 3 rooms, 1 fire, and the fire, in the majority of people over 65 experiencing this triad, is being fed from the gut. I want to tell you about a patient I worked with. A retired teacher in their early 70s who had been to a rheumatologist for knee and hip pain, a neurologist for what had been described as possible early cognitive changes, and their own GP 3 times for fatigue that nobody had been able to explain or resolve. 3 careful specialists, each managing their piece with genuine professionalism. No one had asked about the gut. No one had connected the 3 presenting symptoms to a shared source. This patient was taking ibuprofen regularly, not at high doses but consistently for the joint pain. Their brain fog had been worsening over the previous 18 months. The fatigue was the thing that most concerned the family. When gut assessment was done, an HSCRP, a zonulin level, and a comprehensive stool analysis, what emerged was a picture of severe intestinal dysbiosis and measurably elevated gut permeability. The bacterial species producing anti-inflammatory short-chain fatty acids had been sharply reduced. Pro-inflammatory bacteria had filled the gap. Lipopolysaccharides were entering the bloodstream continuously through a gut lining that had lost much of its integrity. But there was something else in the picture that explained why the gut was in the state it was in. And this is the part I want to make sure you hear. The ibuprofen, anti-inflammatory medications, NSAIDs, the entire class including ibuprofen, naproxen, Advil, Aleve, work by suppressing prostaglandins. Prostaglandins are the inflammatory molecules these drugs are designed to reduce. But prostaglandins serve a second function that the pain relief conversation almost never includes. They are a primary protective mechanism for the intestinal wall. They maintain the tight junctions between the cells lining the gut. When NSAIDs suppress prostaglandins system-wide, that protection is reduced. The gut lining becomes more permeable. More LPS enters the bloodstream. Systemic inflammation, the very process driving all 3 symptoms, intensifies. The medication being taken specifically for the most visible symptom was directly worsening the gut condition driving the invisible ones. When, in close collaboration with the rheumatologist, NSAID use was gradually reduced and replaced with a combination of omega-3 supplementation, topical anti-inflammatory options, and targeted gut repair when the gut lining was addressed and the inflammatory bacterial load was reduced. All 3 symptoms shifted, not overnight, over 4 months, measured carefully. The joint pain remained present, but reduced significantly in severity and morning duration. The brain fog, the one that had concerned the neurologist, lifted substantially. And the fatigue, the symptom that had defied every panel and every referral, began to resolve as the cytokine burden on the mitochondria decreased. 1 source, 3 symptoms. 1 intervention that addressed the source rather than managing the expressions. Now here is what I want you to take from this video that goes beyond understanding, because understanding without action leaves you exactly where you were before this video started. 3 specific things, each one a conversation, each one within your reach at your next appointment. The first is the inflammation panel. At your next blood draw, ask specifically for 3 markers. High sensitivity, CRP, which measures systemic low-grade inflammation, ESR, erythrocyte sedimentation rate, a second marker of inflammatory burden, and, if available, IL-6 directly. Together, these three give your doctor a picture of how much inflammaging is present in your system right now and at what level. If elevated, the conversation about source I, including the gut, becomes clinically grounded rather than speculative. The second is the NSAID conversation. If you take ibuprofen, naproxen, or any NSAID regularly for joint pain, bring this question to your prescribing physician. Given what we know about NSAIDs and gut permeability, is there a gut protective strategy we should be using alongside this, or an alternative approach we should consider? This is not asking to stop your pain medication unilaterally. It is asking your doctor to hold two things in view at the same time: your joint pain and your gut integrity. Options exist: topical NSAIDs that reduce systemic gut exposure, omega-3 supplementation with documented anti-inflammatory effect, curcumin with piperine, and in some cases gut protective medications used alongside the NSAID. The question opens the door. The third is the single most important sentence you can bring into any specialist appointment from now on. Whether you are seeing your rheumatologist, your neurologist, or your GP, say this: I have been thinking about whether my joint pain, my cognitive symptoms, and my fatigue might share a common inflammatory source. Is there value in approaching them together rather than separately? That question names the framework. It invites a different kind of thinking, and a physician who has been keeping up with the research will know exactly what you mean. Let me bring you back to where we began. 3 waiting rooms. 3 conversations that did not speak to each other. 3 sets of treatment, each reasonable within its own frame of reference, none of them addressing the question none of them had been asked to address. What if it is one problem? The research says it often is. The gut, in a state of dysbiosis and permeability, produces a continuous low-grade inflammatory signal that reaches the joints, the brain, and the mitochondria simultaneously. Treat the joints alone, and the signal continues. Treat the brain fog alone, and the signal continues. Treat the fatigue alone, and the signal continues. Address the source, the gut, the dysbiosis, the permeability, the cytokine load, and all 3 rooms begin to clear at the same time. You are not managing 3 problems. You may be circling one. If someone you know has been living with this triad, the aching joints, the foggy mind, the fatigue that no one has fully explained, please share this video with them. Not because it gives them a diagnosis, because it gives them a question, and the right question, brought to the right appointment, can change the direction of years of care. Before next week's video, here is what I want you to do. Over the next 7 days, keep a simple note on your phone or in a notebook. Whenever one of the 3 symptoms is notably worse, the joint pain, the brain fog, the fatigue, write down whether the other 2 are also worse on the same day. You do not need to measure anything. Just observe. Just notice. Because if all 3 tend to worsen together on the same days, that correlation is not a coincidence. It is a signal about a shared source. And next week I'm going to show you what the research says that clustering means and what it predicts about the origin. Come back with your 7 days of observations. I think you will find the pattern difficult to dismiss. One important note before you go. Everything in this video is for educational purposes only and is not a substitute for the guidance of your personal physician. Please do not stop or change any medication, including NSAIDs, without speaking first to the doctor who prescribed them. The goal of this video is not to alarm you about treatment you are currently receiving. It is to give you a more complete picture and better questions to bring to the people responsible for your care. That conversation is where the real progress begins.